Yo, 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 what's crack-a-lackin'? Here we are back at episode 5 of the Adverse Events of Special Interest, released by BioNTech Pfizer for the COVID-19 vaccine. We I am proud to say I have finished off the first page, which we will go through the rest of page 1 out of 9 that have been released so far. It's looking like there's just over 100 side effects per page. So we're looking at probably somewhere between probably about 900 side effects that we're going to end up going through in total by the end of this series. And again, I am just here to read this document. Well, not the entire document, just the side effects for you guys. Because one, this is not easy reading. And I think most of you guys who don't get off on reading scientific papers are going to try and get into it, and you're going to put it down because it's hard. It's not, a great fiction novel. It's really complicated words, and you got to look up literally every side effect. Unless you are versed with medical terminology and diseases and side effects and so on and so forth, you are going to need to read a word, stop what I've been doing, look it up, and then move on to the next one. Stop, look it up, and move on to the next one. So it's really been a slower process than I've anticipated. Of course, I work full-time as well, and I had an extra full schedule this week, so I am just picking up now where I've left off. But I'm happy to say we did leave off at symptom 70, and we will be moving on from there. This video will be a little bit longer. I just want to honestly finish this first page of side effects and get that out there to you guys, and then continue onward with page 2 of 9. So I've also noticed a trend where some of these side effects are like antibody negative and antibody positive, or antibody increased or high or low. So what I've done is essentially like read up on each one of those, put them into one, and then just like summarized it so that we can get through this a little bit faster, because this is long, but doing it in little mini videos when you can watch a 5 or a 10-minute video here and there will just allow you to like learn about these side effects. I'm not telling you to not get vaccinated. I'm not telling you to get vaccinated. I am not a medical doctor. I am just reading the list of side effects and the description to what each of those side effects are. That is it. That's it. You can make your own decision. This information is on the Pfizer website. You can get this document for yourself. You do not have to watch my videos. You can read it and come to your own surmise on your on your own time, and not through these videos. I encourage that, honestly. But I know that this is challenging reading, and a lot of you guys that are saying follow the science are probably not going to pick up this paper and actually follow the science. Follow the science, guys. That's it. Simple. And then you can make your own decision. I think if you're going to consent to being vaccinated, you should know the full scope of the risks of that vaccine, both good and bad. That's all. Anyways, let's go through this list. So, number 71 and 72 was anti-interferon, antibody negative and positive. Basically, this is another indicator of an autoimmune disease, which is typically seen in those who actually contract COVID-19, but the vaccine can also induce this side effect. Anti-islet cell antibody positive. These antibodies are typically found in 90% of patients with type 1 diabetes, insulin dependent, during a time of diagnosis, and that actually tends to wane off unless there is a multi-endocrine disorder. Anti-mitochondrial antibody positive. So positive AMA means there are detectable levels of antibodies in the bloodstream. Although most associated with PBC, it can also be positive in autoimmune hepatitis, lupus, rheumatoid arthritis, and graft versus host disease. I'll have to look up what graft versus host disease is, because I've never heard of that. Anti-muscle specific kinase antibody positive. So MuSK for short is a single pass transmembrane protein that plays a critical role in signaling between motor neurons and skeletal muscle. Antibody positive means the body has antibodies that are specifically attacking this protein. Anti-myelin associated glycoprotein antibodies. Body's own immune system develops antibodies, attack a key glycoprotein, which is responsible for maintaining a healthy peripheral nervous system. Anti-myelin associated glycoprotein polyneuropathy. Similar to the side effect above that I just spoke of, however, it's a specific IgM antibody that reacts with the Schwann's glycoprotein, including MAG and peripheral myelin protein number 22. Anti-myocardial antibody positive can be a sign of pericarditis or inflammation of the membrane around the heart. Anti-neuronal antibody positive. There we go, Nicole. These antibodies are found in those with paraneoplastic neurological syndrome and autoimmune encephalitis. Anti-neutrophil cytoplasmic antibody increased and antibody positive. It's a complex systematic autoimmune disease presenting with the inflammation of small and medium vessels that result in vascular destruction and tissue necrosis. Anti-NMDA antibody positive, a type of brain inflammation that is caused by antibodies. Anti-nuclear antibody increase positive. Indication your body has launched an attack on its own tissue. Anti-phospholipid antibody positive, which is a higher risk for blood clots. Anti-platelet positive, you have issues with blood clotting. Anti-prothrombin antibody positive, high risk for blood clots. Anti-ribosomal P antibody positive, a specific serological marker for lupus erythematosus. Anti-RNA polymerase III antibody positive, a specific marker for systemic sclerosis associated to severe disease with major organ and diffuse cutaneous involvement. Anti-sperm antibody positive, can damage or kill sperm. Anti-SRP antibody positive, leads to severe proximal muscle weakness. Anti-synthetase syndrome, rare chronic disorder that can affect multiple systems of the body. Anti-thyroid antibody positive, suggests that the cause of thyroid disease is an autoimmune disorder such as Graves' disease or Hashimoto's disease. We're moving along here. I'm at number 95. Transglutaminase. Transglutaminase is an enzyme that fixes damage in the body, but an anti-transglutaminase makes antibodies which attacks this enzyme and is often found in people with celiac disease. Anti-VGCC antibody positive. Most patients with VGCC have small cell lung cancer. Anti-VGKC antibody positive. Typically, these antibodies are found and associated with those suffering from limbic encephalitis, epilepsy, and neuromyotonia. Anti-vimentin antibody positive. So this has something to do with mapping of amino acids, but I actually couldn't find a clear definition of what this actually was. There was like papers about this in mice and rats, but other than like that it has something to do with mapping amino acids, I honestly couldn't draw specifically what this is. So if anybody knows, let me know. I was kind of confused about that. I was very confused about that. Okay. Just a few more, guys. Just a few more. Number 99, aortic embolus. Hardening in the aorta and other large vessels. Aortic thrombosis at number 100, which which is, unfortunately, it's often fatal, a fatal condition that most commonly involves the abdominal aorta. Aortis is inflammation of the aorta. Aplasia pure red cell is a rare bone marrow disorder. Aplastic anemia occurs when your bone marrow doesn't make enough red blood cells, white blood cells, or platelets. Arrhythmia is a problem with your heart rate or rhythm of the heartbeat. Arterial thrombosis is blood clot in an artery. Arteriovenous fistula thrombosis, an inflow and outflow issue of blood which can see clotting. And last two, guys, arteritis, which is inflammation of arteries that damages your blood vessel walls and reduces blood flow to your organs. And at 108, and the very last one on page 1 of 9, arteritis coronary, which is associated with Kawasaki disease. So until next time, I will see you at episode number 6, guys. Take care.